All right. Hello, everyone. I'd like to introduce myself. I'm Nancy Allen. I serve as the Executive Director for the National Consortium for Health Science Education. Just a little bit about my background. In my first life, I'm a registered nurse and still a registered nurse. I had a great experience as a clinical nurse and then went to the classroom to be a health science classroom teacher. Enjoyed that job very much, and then had an opportunity to move into administration and worked as the South Carolina Health Science State Leader with the Department of Education in South Carolina. Then went on to work with HOSA, Future Health Professionals, and now most recently in this job as the Executive Director for the National Consortium for Health Science Education. So it just has been a great ride being connected with health science educators, and we're excited about being able to provide this presentation for you today. And with that, I'm going to pass the microphone to my co-presenter, Lara Morris, and let her tell you a little bit about who she is and what she does.
Well, hello, my name is Lara Morris, and my background is athletic training. I was at both the collegiate and high school level, and decided that I wanted to try something else. And so for the last 20 years, I've been at the Oklahoma Department of Career Tech. And this is, I just started serving as the board chair for the National Consortium for Health Science. Like Nancy, I've really enjoyed every aspect of being a part of health science, and specifically the consortium is one of those things that I'm probably most proud of the distance we've come in the last 20 years. So, okay, I guess that's me.
All right, thank you, Laura. Well, I don't know what it's like at your house, but I know in some places there's always a fight for who's going to drive and who's going to have the remote. And as a classroom teacher, many of you are, when you close that door to your classroom, you really can be in control. Now, you're obviously working under state guidelines and school policies, but there is something very independent about being a classroom teacher, and something very important about being a health science teacher and shaping the future for these young people that are interested in health professions. So we're going to talk to you a little bit about being in control, and it's okay to be in control, and doing what's right for your program and for your students. So a little background about the consortium. Okay, here we go. Here's our next slide. This is the really the homepage of our website. We have positioned ourselves as the National Authority for Health Science Education. The consortium began in the early 90s, and it was a collaborative that came out of a grant from the U.S. Department of Education. And it was when the Career Cluster Project was really born, and when the first 4 grants were given to manufacturing. I think it was information technology. I'm not sure about the third one, but I know health science was in that initial group that got a grant. And part of their directive was to create the National Health Science Standards. So today, through this presentation, we're going to talk to you a little bit about ways that we can be supportive of you, and how our organization is here for you as health science educators. So, our vision is that we work collaboratively, and we do that with a group of other individuals who have a vested interest in health science education. So we have members from publishers and educational resource providers. We also have healthcare organizations who are interested in what you're doing in the classroom. And then we have a teacher arm, which we'll talk a little bit more about. So we all want to work together to define and create consistency for the health science education framework, so that what happens in one state may be similar to what happens in another state, and that students are really being prepared to be better post-secondary students and hopefully understand what they're getting into when they leave us and then go on to major in their clinical career specialty area. Okay, as mentioned, we're going to talk about 6 areas of support, and while this isn't all that we do, we think we can frame 6 key areas of support that may be helpful to you as a classroom teacher.
Okay, so those 6 areas that we're talking about, the very first one is confirming your curriculum framework. So as Nancy mentioned, in the 90s, with the Career Cluster Project, we were the lead for that, and we did come up with, we being me and 1,000 of my closest friends who are healthcare professionals in all different areas. It was very important for us to make sure that of all of the professionals we had, that there was a good variety. So this is where the athletic trainer in me says, now wait, do my people need to know that when they first start out? And the nurses in the room would say, well, we know this is what we have to know. And a dental assistant might have a different point of view. So what's really cool about the standards is they've taken the 11 standards that were created are all based on what is the minimum knowledge for every healthcare professional. So, and that's what we set everything up, and that's our framework that we work off of. Again, the 11 standards, each of those standards has the standards haven't changed. I need to say that first. They haven't changed over the years. We have the same 11 standards that we had 20 years ago. What has been changed and has been added over time, we added essential knowledge and skills so that it was a little more fleshed out, and that a teacher would have a good understanding of what it is that would be the minimum everyone needs to know. For students, it gives them a clear direction. This is what I have to know. And the educators or the teachers, again, same thing, just having a really clear understanding. Now, I have to say that over the years, we've had to stop many times and go back and look at and bring in small groups of people to address the standards, the knowledge and skills, because sometimes those things change over time. You remember years ago, we used to have MSDS, and we don't have that anymore. It has a new name. CPR changes all the time. So as things change in the healthcare environment, then we also make those changes to the health science standards. And the hope would be that we can all take these standards, myself in Oklahoma, Nancy in South Carolina, friends of ours in over 40 other states that have that are now acknowledging the National Health Science Standards and saying we want to base our curriculum on those standards. And then the very next part is assessments. And so over the years, we've tried hard to create that framework, the knowledge and skills, curriculum, and an assessment. And so it's been a long road, but we've just keep moving along. So in the past year, one of the things that kind of came to our attention is that sometimes teachers will struggle and say, where do I offer this in my course? And so we've just recently, within the last 6 months, probably put this tool out on our website. And it's designed so that you can see their standard 1 is academic foundation. And then specifically 1.1 has to do with human anatomy and physiology on the left-hand side. The more specific, like standard, describe the organization of the human body in directional terms, and then what that means and to what level. So for example, do I really need to know about the chemical process that happens in cells? Yes. Do I need to know about all the different systems? Yes. And so where this was designed so that a student, or I'm sorry, a teacher then could take a look and say, where in my curriculum do I have that lesson plan? What course is it from? And that's how you, as a classroom teacher, can make sure that what it is you're teaching is actually meeting the standards.
Okay, I think I'll take this one, Laura. So some states have a very developed health science curriculum, and their courses are all laid out, and they've, had a long history of delivering very structured health science courses at the secondary level. And we know that many states are now offering these courses at the middle school level as well. But we also hear from states, because we do try to really provide that support across the nation, to say, we just really need a little bit of help of when to deliver these standards. When is it appropriate? How do you chunk this this content, and how would you lay it out? How would you map it if you were going to teach all the national health science standards within your program? And so, because we were hearing from some states and some teachers to say, really need some help about the sequencing of the standards. And so what we did, and we rolled it out this spring, was we took the National Health Science Standards, all 11 of the standards and the objectives underneath, and we put them into a sample course sequence. So the first course is Foundations of Health Professions. The second course is Essentials of Healthcare Practice. And then the last two courses really focus on Standard 1, which is Academic Foundation, and that's where all the anatomy and physiology and the diseases and disorders are found. And so this information, with all the detail that includes, down to the standard and the objective, is on our website. So you can see, these are the titles, and you can see course descriptions as well as the objectives for each course. And then this fall, which we'll talk about a little later in this presentation, we're going to be doing some free beta testing of the assessments that are associated with these 4 courses. And this may not be something of interest to you, but we felt like it was really an area where some teachers had a need, and so that was the reason that we did take the standards and then laid them out in this 4-course sample.
I want to add to that and just say some states obviously have courses, and this may not align with exactly what your state does, but there's also a number of states that don't have a health science state lead, or they may not have someone who has put things for them into courses. And so this is really just, it was an example, and we hope that it's helpful to people, but it's not something. We understand that in your state, you may have courses already set, and that's what you have to teach to, but this was designed just specifically for people who don't have courses already set, or just aren't sure how to order the information.
Okay, I think this is our second area of support that we wanted to mention. We know that many states through your state education agency have great resources, perhaps great websites with teacher resources to be used at the classroom. But we see this as one of our strategic priorities is to help expand teacher resources. And so this particular resource, not sure if you've heard of it before, we call it the Health Science Curriculum Enhancements. And they've been around for about 8 years. And they're very interactive. It's very interactive resource that includes lesson plans, PowerPoints, projects, technology, assessment items, test items, and it's all organized around the 11 National Health Science Standards. And we've had several revisions of this resource over the years. It's been around for about 8 years. And each time that we tweak the objectives underneath the standards, we would revise this resource in some way. But in January, we actually contracted with 2 classroom teachers. So this will be a resource created by teachers for teachers. And I think the cool thing about this year's resource is that it's going to be able to be used if you have face-to-face instruction, if you have blended instruction where maybe you have some days that are virtual and some days that are in the brick and mortar school, or if your school district happens to go to full online learning. I think this will be a resource that will really enhance what you do in the classroom. It's going to be available in August, early August. We have a website planned, we have a webinar planned for August the 12th. And we usually do those on Wednesdays, and that'll be at 4 o'clock on August the 12th. And this webinar will highlight this resource, as well as go over great ways to use this in the classroom. When we developed this resource, like I said, around 2012, we called it an enhancement for a reason. And that was that we did not want to, we were not trying to take the place of the excellent textbooks or online curriculum that's already available, or workbooks that you already use. But we just wanted something that was a little different, that was more activities, that was created by teachers who really understood maybe some of the struggles there might be to engage with students or to teach the National Health Science Standards. So we're going to call this our game changer. It will be available at our online store. There's special pricing for teachers who are from member states of our organization. There's also special pricing for teachers whose state may not be a member of the National Consortium, but if the teacher is a member of our teacher organization, the Health Science Educators Association, then he or she is also eligible for the special pricing. So keep this one in mind. I think that it's going to be one you can't, you just aren't going to be able to live without. So we are so excited about the launch of this new resource.
So Nancy, before you go on to newsletters, okay, can you tell us what, if I had a past version, why would I be interested in this one?
Okay, so like Lara said, there are past versions. So you'll see this is version 6.0. And the past versions would be aligned to the standards that, you know, were updated before May of 2019. So this is all fresh. It's aligned to the new standards that we revised in May of 2019. But also, I'm just going to say there's a lot more technology in this version, okay? And some of us are better at technology than others, but these particular teachers that we were able to contract with to create this resource, they really have a real knack for creating lesson plans that are rich in technology. And we know that's what your students, you know, that's kind of what's going to hold their attention. And boy, is it hard, even face-to-face, but if you do have to do some online teaching, I just think that you'll find this one's going to be completely different. Now, if anyone on this in this presentation today, we will, if you've purchased it within the last year, we are going to just charge the addition. We have had a slight price increase because we hadn't had a price increase since it was created 8 years ago. So we did go up $50 for teachers with a discount and $100 for teachers that don't qualify for the discount. But with that being said, we have tracked all the purchases in the last year, and we're going to reach out to those teachers to say, this is a game changer. We want you to have this in your hands. We want you to have this resource to enrich what you're doing for students. And we're going to offer them just to pay that additional fee to get, and what happens when you make the purchase at the online stores, you get a link and you're able to download all the contents. And another thing I should mention is that all the contents that are documents, we've included those in Word and PDF because we know that teachers really have a need sometimes to make that document their own. Maybe put their school name on it, maybe change the order a little bit of the lesson plan. So I think that'll be helpful to you too, that if you decide this is something that you want to ask your administration to pay for. We don't encourage teachers to pay for it. You don't make enough money, but certainly we think this will be a resource that'll serve you for several years in the future.
Thank you. Sorry, I got you a little off track, but
Yes.
it's new and it's different. And we just want to make sure that even if you've seen the past ones, that this isn't your mother's jump drive anymore.
Right. Yeah. Let's see. I think this one's me as well. Yeah. So we also produce and publish newsletters throughout the year. We do one specifically just for the teacher that has some classroom activities in it, that has maybe some updates about health-related news. And then we do more of like a quarterly newsletter that includes announcements about professional development opportunities, Wednesday webinars, if we've had any maybe changes to the standards, which we don't anticipate that for a couple of years, but we hope you'll consider joining up with us. At the end, we'll have a place where you can share your contact information. Then you'll be a part of our database, and then the newsletters will come to you, and maybe there'll be some helpful information in there that you can use in your classroom. Oh, wrong way. All right.
Is that?
Sorry.
One more. There we go. So one thing that's really unique about the National Consortium for Health Science is the relationship that we have with our publishers and those that put together educational resources. Our organization has always included the publishers as part of our board, and in the past they had one vote on our board. We've done a little restructuring, and now we have a representative that is an executive committee board member that is in all of the meetings and really does represent the needs from those partners. One thing that's been fantastic about having these people at the table is they're able to really make sure that their content is aligned with the National Health Science Standards. That helps you as a classroom teacher because you don't have to go out and make sure that all these standards are in there. They're doing that for you on the front end. And many of them, if you ask when you call Cengage or some of the other companies, they may even have their curriculum crosswalk to our standards. So that would be that's a nice advantage if you're trying to figure out what would be great resources for you. When we say resources, we also like to remember that there's companies that do testing, and that, so they may not actually publish books, but this is everything you could need: classroom resources, materials, equipment, things like that. All of, who, say it again?
Certifications. We have some
Certifications,
companies that
exactly.
offer certifications. I will tell you that currently we have 22 members in this category, and they're all listed on our website. So if you ever were looking for a contact, we have the national contact there, but they are more than happy to connect you with whoever maybe in your state, your regional person or your state person. So use these people. They really want to hear from you. They really want to know what you need. If there's a new course that you're implementing, or if you have a resource that's really not meeting your needs, what could be changed about it? So we like to be that voice for you. But they are very interested down to the classroom level about how they can be helpful.
Yeah, they'd much rather hear. Yeah, they'd much rather hear from you all than they would from us. So if there is something that you've been thinking, man, if I only had, that's something that you can also, if you don't have a partner in mind, that you could share with Nancy, and we might be able to work with someone to beef up one of their resources to help you with that. The third thing that we do to help classroom teachers is we have assessments and certificates. So almost since the beginning of the National Health Science Standards, we've had an assessment. And I'm not sure, but I think we still may be one of the, out of 16 career clusters, I'm not sure if we aren't like still one of 5 or 6. I'm not sure very many others have a cluster assessment. So that was our first venue that we did, was worked on a great big assessment that would work for end of program. So that's the National Health Science assessment. And the reason we do those things is because it's one way to be able to show employers that what all students have learned, that these are the exact skills they've learned. This tells educators what it is you need to be teaching. It also provides accountability for both you as an instructor and for your students. So we think that this national assessment has always been found fantastic. We've been through a couple different vendors that would be our partner. And in the last quite a few years, we've been with Precision Exams. One of the other things, they've just recently changed their company to U Science. YOU Science. And one of the things that we've done is we're looking at creating, or currently we are creating, end of course assessments to go along with that. So there'd really be 3 different, oh, that's okay. There'd really be 3 different options that you would have for assessing your students. You would have the 4 courses that Nancy mentioned earlier in this presentation. You would have those 4 courses, and each one of those 4 courses will have an end of course assessment that goes with it. And then there's the granddaddy, that's the whole program, end of program assessment. And we also have been partnering with Precision for years to promote there and to let you all know that they have a number of different assessments out there for other courses, and specifically some that are healthcare professions. So especially for those high school students that might not be able to get into an accredited adult program at this point, but they want to take a test in dental assisting, or maybe they want to take an exercise science test. And so we also want to promote those resources that Youth Science has created and has adapted to let us consider it part of our whole store, I guess might be the easiest way to say it. So just as a reminder, the assessments and certificates, that's what gives you an edge. People always say, why should we do that? I mean, why would I pay money for a student to take an assessment? Because on the back side of that certificate, it tells a employer exactly what that student has learned. And that goes a long ways. If you have two students side by side and all other things are equal, I keep wanting to use the game changer again, Nancy, because I love the way that sounds, but I do think that makes a huge difference. You also receive as a teacher, if you offer these assessments, and by the way, they're proctored by a third party, not you. But you do have access to the data that will come back from all your students that took any one of these assessments, and you can see what area you might need to beef up. Maybe they aren't doing well in a specific safety component, or maybe students aren't the academic foundations. What we found years ago is a lot of people did terrible on academic foundations. Well, once we start talking to teachers, it's because the students hadn't even had anatomy and physiology yet. And it's kind of hard to be successful when you haven't had a huge part of your standards. So anyway, the certificates they're beautiful, like foil embossed. I mean, very high class certificates that are great for a student's portfolio. So just want to let you know those options are out there. I think this one's you. Oh, no, it's me. Hey, guess what? It's an L, not an N. So that's Lara. Nancy and I have both spent a lot of our lives being proponents of HOSA, which is Future Health Professionals. So one of the great things about having a student organization is that we can take those things that we're learning in a classroom and being able to put it into practice in a student organization. As you can see, this is just one example, and this is posted out on our website. You can see the competitive events, which I believe there's somewhere around the high 50s, I want to say 58 or so, different competitive events, and you can see by the stars which one of the standards this aligns to. So it's really cool if you go through and you're thinking, well, I don't really do HOSA. Well, you may do a lot more than you think you do. If you have a classroom that has an officer team, then that's part of leadership, is part of HOSA. If you have classroom speakers that come in, there's so many different ways. You don't have to be part of competitive events, but if you do, we highly recommend using HOSA's pre-made rubrics for these competitive events that can be used in the classroom for a skills checkoff. If you're having them do a speech, I promise there's a speech rubric in one of these competitive events that you can take and use it instead of having to recreate things all your own. The HOSA is one of our favorite things that we do, and we have a great partnership with HOSA as well. The National Consortium helps support scholarships, and then National HOSA has always been a good supporter, and they've been a member of the National Consortium for many, many years as well. Okay, the fifth thing that we do is building networks and partnerships. So you may wonder how on earth how does that work? Well, this has been, this gets me almost a little weepy, you know. That's what happens when you're of a certain age and you stop having hormones. Things like this make you weepy. But the Health Science Educators Association is something that went into effect in 2018. And we have slowly but surely been adding to our numbers. And do you have a current? I want to say it's over 350.
Yeah, it's approaching around 375, I think.
Okay, so we have a large number of teachers, considering that most of our promotional materials have been done. We've done a few individual presentations in states, but almost all has just been online. And one of the coolest things about the Health Science Educators Association is it does give you that network of professionals. We have a Facebook page. If you're a member of the teachers organization, we give you access to all kinds of resources that you won't have access to if you're not a member. But what's cool, what we've seen most lately is people reaching out and really utilizing the resources that we've been working on, the webinar Wednesdays. So every other Wednesday when school's in session, having some type of webinar. We had an all-day webinar at right during the COVID outbreak, and they spent with two of our members spent the entire day on a Saturday putting out doing lessons on how to teach online. I mean, that's the kind of thing that I didn't hear of any other group that was doing things like that. So that it's a fantastic group to be a part of. Now we're able to see them asking each other questions online. Hey, how do you do this? Do you have a good lesson for such and such? And that's exactly what we always dreamed that we would do, is to take our organization from just being national health science leads to down to the classroom teacher where it really is important. And so we're just so excited. And I guess I could talk about that all day, but I won't.
There is we should say there's an annual membership fee.
Yes.
And that's $45. And so we'll, once you join, then you're in our system, and then we'll do annual invoicing when each year when school starts. So if you can visit, if you're interested, there's a link on our website where you can go and fill out a membership form, and you can pay online with a credit card, and we'd love to have you as a part of our group. So that's kind of teacher to teacher. And then when we think specifically about your health science program, we know that some of you are probably really good at this, but you really need some big friends, and you need people to know who you are. And some of the best friends need to be guidance, because we know the guidance counselors, school counselors, career counselors, they can really be the gatekeeper for your program. And they're the ones that really are influencers to students, and when they look at their interest inventories, you know, where their electives should be. So make friends with guidance, invite them to your class, let them see all the cool hands-on activities that you do, and then they'll start to remember, you know, when that student comes by, and you know, to suggest your program. Also, make sure the community knows who you are. Those are good friends to have, whether you invite them to your class, whether you volunteer, whether you offer to do community service with them, but just being a part of your community, being in the local newspaper, being on local news channel, just really promoting your program, and it just will all come back to you in a good way. I'm assuming that as a career and technical educator, you're required also to have an advisory council. And we know that you want to be very strategic about who you invite to be on that. People that can really be helpful to you in giving you advice and giving you direction about what your students need to know and be able to do. And just make sure that you have those people that have a passion for what you're doing. And then some of those can end up being work-based learning partners. We know that it becomes a struggle at times to find placement for high school students because we're kind of on the bottom end of who gets, there's maybe 2-year and 4-year programs in your community that take precedence over yours. But if your students are so well prepared and so professional, and you find those work-based learning partners that really like to teach, and sometimes I'll hear people say, well, we don't really have time for students, or maybe this isn't appropriate for a high school student. Well, somebody taught you. And so we just encourage you to make good contacts. And we also have a resource, a work-based resource that that will be that's on our next to do, is to update that. But it is a fairly inexpensive resource that you may want to look at. It has some great rotations in there, 20 or more different departments throughout healthcare facilities and hospitals that you could, your student could go into a facility, would have questions already made out for them, things to look for, and that might be a little helpful to them as opposed to them standing over in a corner. So that resource is on our online store as well, and we'll be refreshing that hopefully in the next year.
Great. Well, that takes us to number 6. In case you were thinking, will they ever stop? The answer is yes, we will. Let us tell you about our professional development opportunities. One of the things that has been extremely, we've received a lot of positive feedback from are our Wednesday webinars, or Webinar Wednesday. You can say it either way. It's like Taco Tuesday, however it helps to stick in your mind. Our goal is to have a couple of those every month. And so far, the ones that have been completed are archived on our website. So if you want to take a look, we've had individuals from testing companies. We've had speech pathology, language, and hearing association. I totally brutalized that. Anyway, to learn about what kind of speech professionals there are, and all kinds of just other interesting things about assessment. And we have a great lineup planned for the fall too. So you don't want to miss those. There is no cost for Wednesday webinars. We just want you to log in and watch from the comfort of your own home or your office, whichever one you're allowed to be in. So the National Health Science Conference, for the last 20 years, we've offered it every other year. So last year we decided, hey, let's start offering it every year. And then, dun, 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 COVID-19 happens. And so this year's National Health Science Conference is going to look a little bit different, but there you go.
I didn't have to go there.
Oh, that's perfect. So just to remind everyone that the Health Science Conference, we're not going to be able to have it in Charleston, South Carolina this year like we had planned, but we are going to deliver a virtual conference. And obviously details are under construction. This conference was to be held at the end of October, and so we're still trying to figure out. But the cool thing is, if you want to be a presenter and you don't have to leave the comfort of your own home. You could put together a presentation and share it with teachers all over the United States if you want to. The details are all out on our website, the information that was originally scheduled out there, the updated information will be out there in the next couple weeks or so. One other thing I forgot to mention was about the webinars that they usually start at 4 p.m. Eastern time. So that again will also be on the website. You can take a look and see what might be interesting when we start those back up. The most important thing we could probably tell you about is our website. We've mentioned it over and over and over, and this is a perfect time to get out a pen and paper and jot down the old-fashioned way, if you want, healthscienceconsortium.org. So, Nancy, I'll turn it back over to you.
All right. So remember, we started the presentation with a remote and talked about controlling what you can control. And we certainly hope we've given you some ideas about things that you can control and things that you can do that are right for your students. So as Lara said, visit our website, lean on us, let us know how we can help you deliver high quality health science education programs. That's what we're here for. If we don't know the answer, we have experts that we can connect you with, and it's just our passion, and it's the lane that we're in, and it's what we want to do for you. We also would be interested in your input. Again, I'm Nancy Allen, and my friend Lara, appreciate her co-presenting with me today. Our email addresses are on the website, but if you want to get out your phone and take a picture of these two links on this slide. The first link is to a survey. Want to hear from you as teachers. What do you need? Where do you see your areas of need? And we're putting this link out in a lot of different places. We're going to get that data, and we're going to as a guide for us in creating priorities for the next year. So take a picture of that and please fill out your information. We will ask you for your name and your email address. We won't bother you, but we will add you to our database so that you'll be able to hear about good things that are happening with the consortium. The second link is about certifications. We spent a little bit of time talking about that. We'd like to know how you use assessments and certifications within your class. The cool thing about a particular survey, it's yes, no, yes, no, yes, no. So it's, I think it's a simple yes, no questions. And you do have a chance there if you're interested in that free beta testing that we're going to do for those 4 courses that we talked about. Even though you don't offer those courses, you could probably go on our website and see the description and the standards that are included in each one of those courses. And you could see which courses, if your students have completed, where they might be successful. And so, like I said, that will be at no cost. We're trying to validate these tests. So we need testers to tell us if these are good test items, if they're performing like we want them to. We have one we're hearing from to say, you know, everything came to a halt in March. We don't really know what our students got, and we would like to use this beta test to see where they are in their health science course, and if they're, you know, where they might need some remediation, or if they're ready to move on to the next. So just plant that seed. But thank you again from the National Consortium for Health Science Education. We hope you have a great year, no matter what that looks like. We know that health science teachers are just a cut above. So we wish you much success in the school year. Please reach out to us if there's anything we can do to be helpful. Anything from you, Lara?
No, ma'am. Thank you guys so much for hanging with us. And please, just like Nancy said, let us know how we can help you. That's truly what has been our life's work, is to try and help people. So let us know. Have a great rest of your day. Thanks.